Patients with anxiety are very frequently cautious about medications in general because if you have a history of medication side effects and a history of anxiety, it's very natural to be concerned about any time you start a new regimen. One thing that's reassuring for patients is just the fact that we're very comfortable managing these medications. We understand how the medications work, and a lot of how you experience, the titration up or down of medications based on the prescriber's knowledge and the regimen that they prescribe. There's a misconception that anxiety is provoked by stimulant medications. It's actually not true. So stimulant medications do not cause panic attacks. As a matter of fact, we often find that patients with anxiety see some improvement of symptoms when they begin their ADHD regimen, because as the world falls into order and the chaos starts to calm down, and, naturally the anxiety calms down with that. My suggestion to patients who have a history of anxiety, are a little nervous to start medication, worried about side effects, would be to have an open discussion with your provider. That's the whole point of the team-based approach, is that we sit down with our patients, we go over your concerns, we want to hear your goals, we want to listen before we start recommending and make sure that we address those concerns. We can start at a lower dose. We can use sometimes stimulants that are a little bit milder. We can look at some of your other medical history and find out which ones would be a better fit based on that. So there are a lot of options, and I certainly wouldn't discount stimulant medications just because of your history of anxiety. Now, having said that, there are some other medications, non-stimulant medications, we can use. Inderall is a great drug. Its other name is propranolol, and it's used for stage fright or situational anxiety. It has benefit with migraine headaches, has benefit as far as hypertension goes as well. And for adults, it's commonly used off-label for inattentive ADHD. So that would be a very reasonable option in patients with anxiety. Sometimes we will also use Wellbutrin, and while that doesn't have as much of an effect with regards to anxiety, it does help with depression. And where we see anxiety, we often see depression, and so sometimes patients will benefit from that as well. Strattera is another non-stimulant medication we use. That one it can be very helpful in patients that have been previously intolerant or are unwilling to take a stimulant. So those are just a handful of the non-stimulants, but there are a lot of options to treat. I think the biggest message here is, don't ignore symptoms of ADHD and things that are impacting your life because you're nervous about the medications. When you see your doctor, it's really just for a consult to get some more information. You're never obligated to start a medication. We don't get upset if patients decide not to proceed. Our goal is to hear you and then recommend things that we think can help and to work with you.